Hello, my name is Grainne O'Kane and I am a Medical Oncology SPR and current chair of the Collegiate Members Committee, the trainee committee within the Royal College of Physicians Ireland. Today I am here with Professor Kevin Imrie, incoming President of the Royal College of Physicians and Surgeons in Canada. Professor Imrie has just completed an external review of postgraduate specialist training within Ireland. And today we're going to talk a little bit about his findings and indeed his experiences of training in Ireland. Professor Imrie, thank you very much for coming here today.
Great, it's my pleasure.
Thank you. How important do you think it was for the college to make the decision to embark upon an external review of postgraduate specialist training?
I think it's very important. I want to commend the college for doing it. A lot has changed in medical care and in medical education in the last number of years. And this is a very important time for the college to be able to pause, review, and really plan for the future.
Changing demographics and societal demands have impacted healthcare globally. How do you think training should conform to meet the needs of the patient?
It's a great question. So there are significant changes in the population. Our population is aging. There's significant changes in new treatments and new technologies. But there are also real changes in the structure of the medical system, in the health professions, and what we expect and what our patients expect of our doctors. And all of that needs to be reflected. The Irish training system and the programs of the college have served Ireland very well, but we need to make sure that they continue to serve the Irish population well into the future.
Okay. And I suppose in your report you talk a little about generalism versus specialism. How important do you think it is to obtain a balance between both?
I think it's critically important. With new technologies developing, there will be a constant pressure towards specialization. But it is also very important to have physicians that are comfortable practicing a full breadth of practice and providing comprehensive care to patients that increasingly have multiple medical problems, where siloing their care can actually be a real disadvantage. And I think this is an area that Ireland can really be proud of, that in contrast to my experience in North America, I think there is a very generalist approach to the provision of training and also to practice that we have a lot to learn from.
So doctors in Ireland can spend approximately 10 years training before becoming a consultant. In Ireland, trainees tend to move between large tertiary referral centres and smaller hospitals. Do you think this is an appropriate model?
Absolutely. I think it's critically important. I think it's very important for the programs of the college to train trainees to be able to practice in a variety of practice locales and venues. And there are unique skills that are needed and competencies to practice in large urban tertiary care centers, but there are also unique skills that are required to be able to practice in smaller and more remote centers. So trainees should have an exposure to both.
Okay. And in your experience, what do you think are the best mechanisms to ensure that trainees acquire the necessary skills and competencies in order to deliver safe, quality patient healthcare?
Well, there's an international movement towards competency-based medical education, which really involves moving away from the idea of focusing on how much time trainees spend in a place or what we teach them, and placing greater emphasis on what we can do. What the trainees can do and how we can demonstrate how they perform. And I think that the college is ideally positioned to be able to capitalize on those forces.
Okay. I suppose there's probably advantages and disadvantages to healthcare systems in Ireland and Canada. What would you see are the main differences between both?
I think there are many more similarities than there are differences. And I think one of the strong recommendations that come from the Lancet Global Commission report is that we have a lot to learn from each other, and that there should be greater partnerships between countries to be able to learn from our shared experiences, but that our systems really need to serve the local population needs of our country and need to be tailored towards the specific country in question. I think the Irish medical system works extremely well, and I think the college's programs prepare trainees very well for practice in Ireland. I think that Ireland is a somewhat smaller country than Canada, both in terms of population and geography. And I think the commitment to generalism is something really to be valued here. I think it's a bit different from my experience in North America, where care risks being a little bit more fragmented.
So there has been a huge drive in Ireland to implement the European Working Time Directive. How do you think this is going to impact upon training, and how do you think we should be measuring these outcomes in the future for patients and for doctors in training?
The European Working Time Directive is a reality that programs are going to need to adapt to. And the sense of paying attention to the hours that residents work and the impact it has on them, or trainees work and the impact it has on them and on their patients, on their training programs, is something is a universal force that's being evaluated across the globe. There's no question that bringing in the European Working Time Directive will have an impact on programs, and it needs to be done thoughtfully and carefully. It's going to be very important for the college to be able to teach handover skills amongst trainees, to be able to provide an opportunity to share best practices and experiences in rotation scheduling so different sites can learn from each other, and really to monitor and to mitigate the impact of the European Working Time Directive on trainees and the programs.
Yeah. And are there ways that we can ensure standardization, I suppose, across sites from a training perspective?
In terms of
the training that we each acquire as a trainee, and that we all are at a certain point at a certain time?
I think that is you've highlighted a critically important point, which is that Ireland is a diverse country, and you've got trainees that are working in diverse environments, geographically and in different types of hospitals and different sizes, and that's a good thing. And that variety is a very good thing. And we don't need to ensure that everything is homogeneous. The experiences shouldn't all be the same, but they should be of the same caliber. We should ensure that the opportunities exist to gain the same teaching and the same expertise regardless of where trainees are sited. And that's going to be a critically important role for the college to play a critical function in terms of setting that standard and ensuring it's met throughout the country.
Yeah, absolutely. In Ireland, I suppose many of us train for up to 10 years and sometimes more before we become a consultant. How does that training time differ with Canada, or is it similar to the Canadian experience?
I would say that on average, it does seem to me that the time from the time that a trainee enters a BST training until they actually take up a consultant post may be somewhat longer here in Ireland than in Canada in some cases. In fact, that's probably more because there is a tendency to move in and out of training, to have an opportunity to get other experiences that aren't available in training. The actual time in training is fairly comparable to that in Canada. The other force that's a little bit different, as we mentioned, that in Canada we tend to have a greater force towards subspecialization. So at completion of training, many more Canadian trainees would extend their training to get further subspecialty experiences. So on average, it's probably fairly comparable.
Okay. I suppose as a trainee, it's been great to read the report, and we've read similar types of reports globally over the last number of years. Where do you see, or where do you think we should be in 2016 in terms of potential implementations? Because obviously there's a lot gone into the report, there's a lot of actions. What do you think would be the most important things to focus on?
I'd like to highlight sort of two components to your question. So the first is, the trainees are critically important to the system. Our current trainees are the consultants and trainers of the future. And it is absolutely essential that trainees have an important voice in important decisions of the college, and even day-to-day decisions of the college, that there is a very good two-way communication, and that the college is very receptive to the views of trainees, and who are, the trainees that I had the opportunity to hear from were really committed to wanting to make the system better, and that was just wonderful to see. The second part is really about implementation, and certainly the sense I've had right from the first conversation I had with Professor Crow was that his sense was that there was an urgency to this, that the report he wanted to have completed, and he wanted, right from the time the report was completed, an implementation plan to be developed, and he wanted work to be done, but also work to be seen to be done, so that trainees and others in the system can get a real sense that the college is taking this seriously and is committed to making changes on that time frame, that 2016 time frame that you mentioned.
As you've already alluded to earlier, Irish trainees are extremely well regarded internationally, but a lot of our doctors are leaving. Do you think this is concerning?
Again, it's a great question. There are a couple of components to it. So the first is the aspect of trainees choosing to leave Ireland to pursue further training. I actually think that's a very good thing, that I think there's a tremendous value to the Irish population to have physicians that have had an experience in a variety of systems that can bring the best of those systems back. And I would certainly not be wanting to see changes that restricted that opportunity, because I think it's tremendously valuable for the trainees, it's tremendously valuable for the patients, and for the hospital administrators as well. I do, though, get a sense that currently there are forces that provide barriers to trainees coming back here to train, and that those barriers lie outside of training largely. I think that's because of issues in terms of employment opportunities and the nature of employment within the country, and I have a sense that the system realizes that that's a real challenge and that there are steps that are being taken to remedy that situation. And I think that if those steps are taken, there are a significant number of excellent, highly trained individuals that have chosen to get experience elsewhere that may well be in a position to be able to come back and play leadership roles in the system in the future.
Yeah, absolutely. And do you think, I suppose, coming on from that a little bit, that we should be engaging with trainees a little bit earlier in the college?
Absolutely. I think it's critically important, especially in the BST period. My sense is that during HST training, there's a close relationship between the trainees and the college, and they really understand what it's about. In a BST period, particularly if individuals are on a scheme that's based outside and don't have an opportunity to interact that much directly with the college, they don't really necessarily get a sense of what the college is and all the resources and all of the things that it can offer. And any steps that can be taken to provide more information, but also to get more information, to really get input and feedback from the trainees, during those early phases that can help to improve the experiences for the next sets of trainees will be incredibly valuable.
Yeah, absolutely. So thank you, Professor Imrie. So as a representative of trainees at the college, I would like to commend the Royal College of Physicians for making the decision to undertake this external review. I think it's crucially important to recognise the changes in patient needs and to recognise the changes in needs of doctors in training. And I suppose I would also like to take this opportunity to thank Professor Imrie for his contributions, and especially for understanding and listening to the voices and opinions of trainees.
Well, you're most welcome, Grainne. Today's trainees are the trainers and consultants of the future, and it's critically important that they have a voice.
And certainly after today and the report, I feel very excited and inspired about the future.